Tuesday!
Happy Twin Tuesday!
Whoop whoop! Yeah, Dr. Johanna here and
Dr. Madeline,
we are the awesome chiropractors at
Atlas Chiropractic Center.
Yes, which is located in St. Petersburg, Florida. If you're not local watching us, and if you are, holler, give us some shout outs, give us some love.
Yeah, this is Dakota. He's our mascot. And as you're hopping on, please drop some emojis. Dakota loves emojis, so he would like to see them and see some highs.
Yep.
If you're jumping on replay, then let us know Team Replay down below so we make sure that we say hey, because we appreciate all of y'all who watch it, and to make sure if you have any questions that we get those answered for you as well.
Absolutely.
So I think real quick, we have some cool stuff coming up in the office. Not that we have to go into too much detail, but I think we should tell them about it before we dive into all the good stuff today.
Oh yeah, so while we're waiting for people to jump on, we are running a contest this month in the office. It started yesterday. It's going to run all the way to February 13th, so for a full month. And what the contest is there's a couple ways to enter, and you can enter to win a super cool wellness basket that was originally supposed to be about $100 value, and it just climbing because we have a lot of wellness partners out there and they want to donate different things, so you're gonna really want to win. And well, what's in the basket? Let's start with that.
We have a cool shirt, and you'll be able to pick your size. Right now my size is in there, but you don't have to wear my size.
It says, tell me,
ask me why I'm so well adjusted.
Yep, so that's cool. Go Chiropractic.
You have a bath soak in there made from a local place that is non-toxic and has a low carbon footprint. It smells amazing.
It does.
We have a Kawa gift card for local coffee and Lucky's, which is a local or grocery store here. I think it's like Whole Foods and Publix had a baby grocery store typically.
Yes.
We also are supposed to get a massage gift certificate put in there and some non-toxic essential oil cleaner. So
cool.
Got some pretty awesome stuff in there. You can get entered a couple different ways, which we're going to send out an email about, so check that out.
Yep, check the email. There's 5 different ways to enter. Just to run through them real quick, and then we're going to jump into today's topic. You can check in on Facebook anytime you're in the office, and absolutely do that. That helps us expose and get more people in our health and wellness and get them better. It also, you can give us a Facebook review or recommendation. You can give us a Google review. You can refer a patient into the office to get an entry, and
a testimonial
written or video is completely cool.
Yeah, so we have some different ways you can enter.
Yep.
Cool. So I've had this come up a lot recently, not with patients, because typically our patients that are here understand some of the stuff we're getting ready to talk about. Yep. But I would say with like my friends that maybe don't live locally, so they don't get the opportunity to come see us, or just different people I run into the community. And we just want to make sure you guys have as much information as possible. We've talked about that we are both very passionate about empowering women on their healthcare journey, because there's just not enough positive, I think, information and support out there. Yeah. So whether you see us or you see a different provider, we want you to feel comfortable in that decision you make. We want you to understand what questions you can ask, and anyhow, that you're just fully supported within that journey.
Yeah, absolutely. I mean, I was thinking about this today. I was running today, which is super awesome.
That is awesome. So if you're watching, emojis, because that is so great.
I've been working really hard to get back to running after having Mr. Dakota, and it hasn't been the easiest path, but I have a great support team with Dr. Madeline and my pelvic floor PT, who's Dr. Kaylee, and I was able to run 16 minutes straight today.
That's awesome. That's huge. And we want you to know, if you're a mom, or not even a mom, but like that's where you're at and you want help, to know that you can get back to those things.
Yeah.
And we have a great support team at the office for you. We have great resources in the community for you. If you're one of our lovely people who follow us from a distance, we can help you find that in your community as well.
Yeah.
Because that should be the mom's story.
Yeah.
It shouldn't be when they're still 40 and peeing their pants, are not able to run. Or
well, I was going to say, there's more details to that. It's not just that I can run for 16 minutes uninterrupted. It's the fact that I can do that without feeling like I need to go to the bathroom or having leakage or something like that. And then maybe TMI for some people, but a lot of women that have been pregnant and that are postpartum understand 100% what I'm talking about. So that is a huge win. And the reason that's really important to me is for a couple reasons. I de-stress and manage things like anxiety and depression and just what's going on in my head through physical activity. So it's huge to be able to get back into that. In addition, I get real creative when I run.
I know!
My creative juices just start flowing. And it's hard to take notes when you're doing that, but I know today I was really thinking about ways that we want to empower women in our community and internationally to help change their health, because the standard of care is really low. And the one thing that did remind me of this is I saw a post on Facebook shouting out a pelvic PT in the area. And I thought it was amazing because the woman was just expressing her how much of a positive effect that it had on her, and that she feels like everyone should see one. And I commented back because I agree with her, and that is the standard of care in other countries, not here. And I'm not saying everyone needs treatment, but everyone postpartum should absolutely have an evaluation to see if they do need treatment or not. And that usually in the other countries happens right around that 6-week postpartum check with your midwife or your OB, and once they give you a clear, you check in with your pelvic floor PT so they can give you the clear, and that's so you can avoid things like later down the line with different stuff like leaking, but also I'm talking about like years and years down the road, there's tons of things that can be fixed with that. So anyway, that was making me think about that, and because of that, there is a difference in chiropractors, especially when you're pregnant and postpartum. There's a different type of care that you may not know, but you want to seek out and hopefully get provided with. There's a way to find those practitioners, and I just think that if you don't know if your chiropractor does it and you're pregnant or postpartum, the answer is no.
If you don't know, the answer is no. You would know. Their office would look like ours, they would talk to you about it, that type of thing. But you can check, and you can ask them questions by all means. So that's what I want to talk, like what we want to talk about. We know during pregnancy, you are more than likely, most women are going to experience something at some point. Like low back pain, neck pain, not being able to sleep because they're having hip pain, shoulder pain,
sciatica, carpal tunnel,
round ligament pain, which would be pain more in that front of the abdomen, and that pubic symphysis, so right at the bottom of your abdomen. And that's just during pregnancy, let alone postpartum. When you're breastfeeding, you're barely sleeping, so your neck hurts, your wrist hurts, your back hurts, I think your hair hurts, right? Like everything. It's part of that phase of life, and that's a lot of stress on your body that shows up in a musculoskeletal, like nervous system way. And we love helping our moms with that. Through that whole journey, we understand it, we take extra education in it, we thrive at it, we hold space for you all. I love talking to our pregnant and postpartum moms and treating them and seeing them in the office. And then we get to meet your little one when they come earthside, which is even cooler. But there is a difference, and we can help with that, so you don't have to have drugs. You don't have to look at surgery down the line or injections. We can get you out of pain, usually in a couple of visits. And then it's usually just like, by that point, you're like, this is so awesome. Like, I can't do life without this anymore. And it can prep for an easier labor with less interventions. So you're usually like pretty part of our family by the time you're here for a couple of visits.
Absolutely.
But please know, there's a difference. So I like to tell my patients this, or other women when they ask me, if I was to become pregnant, I would no longer, if I go to, let's say if I went to a regular primary physician for regular checkups, I would not normally see that family physician, that primary physician during my pregnancy. Where would I go? I would venture to a specialist, right? I would go to an OB or a midwife during that time that I am pregnant to monitor me and help me through that pregnancy. So when you were pregnant and you were searching for a chiropractor, a physical therapist, an acupuncturist, there are ones with special training, with specialty, to take extra hours and education and knowledge to help you even more. And there is a difference, and it's doing a disservice to the mom if the practitioner doesn't have that. They're just not getting all the benefits that they could and all the support. So what are some questions maybe they can ask? Or where to look?
Well, I mean, okay, so you can look on the ICPA for kids. Oh my goodness, he is very pumped
He's
about
also
this.
passionate about this.
You can look on the ICPA for Kids website. There's a locator on chiropractors on there, and they will have a little thing when you search your area that says Webster certified. So the easy question to ask your chiropractor is, are you Webster certified? And you want them to be certified. You don't want them to say something like, I learned that once from a friend, or I was taught that once in school, because there's an actual certification to go through, because it's very technical, and it's important that you do the right things to get the max benefit from that type of technique.
And you can go to the website and check, or they more than likely, and I would have to turn the camera around, but we have a nice little certificate hanging on the wall because we did it. So I've also been around, and it's just not fair to the patient and the mom, so this is why we're telling you this. I've been around other places that they're like, yes, I see pregnant moms, and they might see pregnant moms, but that does not mean they're Webster certified, does not mean they took the extra education, and that's just one step of an extra education for our mamas. We've taken more than the Webster.
Right, and there's tons of training to see this type of demographic in your office, to see pregnant moms, to see babies and kids, And recently there is a seminar through that training that was basically called Advanced Webster. So it was additional things to check for if you have a really complicated case, so a complicated mom or baby's not in the right position, that kind of stuff. But in addition, we have care postpartum, and that's going to vary based on education, like where they taken classes at, but that's something you can absolutely ask. Well, what kind of education do you have for me as a postpartum mom? Like, what are your max benefits for me? And that's going to be things like what?
That's like birth fit. There's a few different ones out there. So we both have went through Birth Fit's program and offered services throughout the past year and stuff with Birth Fit in mind. And they approach, what I love about them is they're so intentional, and you'll get this a lot in our office, whether you're a pregnant or postpartum mom patient, but we do talk to you about your mindset and that healing protocol, but especially prepping for birth and postpartum and giving yourself grace and reconnecting to body and baby during that time. So Birth Fit is definitely one of them.
And that reminds me, you have to give yourself some grace as a mom. Like today when I was running, I'm like, I know moms out there are like 8 weeks, 12 weeks postpartum, killing themselves to get back into pre-baby shape. I'm 24 weeks postpartum. Last Sunday, 24 weeks. And I'm just now getting to that. And I've been very active and physical majority of my life. So I understand the mental battle. I understand 110% of the whole time, things like that. But definitely give yourself grace, which is where the mindset comes in big time. And I think it helps to hear that from other people.
I think so too. Absolutely. So Birth Fit's another one. There's some other good ones out there. I just talked to another chiropractor recently, and she did the Bloom method. It's really good. Our really good friend who we co-managed with pelvic floor issues with is a pelvic floor PT in the area, also recommended that. So I feel comfortable if other practitioners have done those type of things. I feel comfortable if your chiropractor who specializes in your pregnancy and postpartum care is very, very open to co-managing and working with a pelvic floor specific physical therapist with you as well. Because they do different things than we do. They do different exams, they do different treatment. So we go really well together. But I will tell you, neither of us offer what Dr. Kaylee does.
Heck no.
And I don't want to specialize in that. That's why she's there, and she is her jam, and she is awesome at it. And then we take care of other parts that just support you even more.
Yep.
So
ask the questions.
Like, just ask the questions. Like, ask them, like, do you have the extra certifications? Have you spent time doing this? What's the majority of your population you see doing this? Because at the end of the day, I think that, like, their heart's in the right place, but I want to advocate for the mom. And I want her to get the best care possible through her pregnancy and postpartum. And there's just a difference. There's a difference. And
I mean, and I know you've had this experience too. There's been a handful of times in the years I've been in practice that I've had chiropractors, like male chiropractors' wives, reach out to me because they have been getting adjusted by their husband throughout life in their pregnancy, but their baby's not in the right position, and they seek out a Webster certified chiropractor like that. And I think that's great, and I think that's amazing that they're open to that. Now, speaking from a position of not being in a chiropractic family and having someone that can adjust you, and if you've never been to a chiropractor before, you don't have to worry about like taking a hiatus from your current one. And you're pregnant, you really want to find someone that has that certification, because it's just going to give you what you need from the very beginning and help you rock and roll from day one.
And what we do too, which was really important to us when we opened our doors for you all, is we have time for you when you're here, because we find, and we love that it does, but our pregnant and postpartum moms need a little extra time, and that's okay. I want to have where I have 15 or so, or whatever you need, to be able to talk to you if you're having a really tough day. And we need to talk a little bit more about that mindset, or if you have extra questions that take a little bit longer to explain. Yep. And we have space that if you need to nurse, so I think you should find a location that you're comfortable in, that most of the time our moms that are here, our new moms, have to nurse when they're here, or need to change baby. And you can do all of that here. You can bring your family. We also have very, very comfy pillows and special things for you to lay on, so you can lay on your stomach for a little bit.
And your babies, I just had him in the pillow. He was loving it.
Yeah,
he was having a blast.
So like those offices should have special extra little tools that help with your comfort to be able to get adjusted in the right way and to support that as well.
Yep, absolutely. So I want to wrap it up because we have patients to start rocking and rolling and seeing, but definitely ask the questions. You pick your healthcare provider. If you are pregnant and postpartum, you wouldn't go to your regular doctor for that type of condition, so you would go to a specialist. Same thing when you're talking about being pregnant and you're picking your chiropractor, so definitely look into that. Come check us out. We're having an awesome, I don't want to cuss on here, you're having an awesome launch party tomorrow night for Dr. Madeline, Dr. Kaylee's
Vaginas and Vertebrae. It's our podcast about turning women's healthcare upside down.
Yes.
So if you are local, come check it out. It's at Atlas Chiropractic Center at 6:30 p.m. It's kicking off. We will do a recording. We have giveaways, a lot of cool giveaways and stuff. We're going to be answering your questions. There's going to be networking and mingling.
It's going to be awesome.
It is. And we talk a lot about this on the podcast too. So definitely hop over. It's on Spotify. It's on iTunes. We have went over what questions to ask a chiropractor to see if they're ready to serve you during your pregnancy and postpartum care, what questions and how to find a proper pelvic floor physical therapist. We just went over considerations or things for working out during pregnancy, and next week's will be exercise considerations and when is too soon to get working out postpartum.
Yep. Cool. So all kinds of neat things coming at you. Make sure you're checking in. And I just thought of an additional way to win tickets if you like our Facebook page, because I think some patients out there have not. So make sure you like it.
All right.
See you next entry.
We'll see you next week.
Yes. Have a good one.